Hi, welcome today. Your name is Azalea?
Yes.
Hi, I'm Kelly. I'm the nurse, and I just want to make sure you're ready for me to do a head-to-toe assessment on you. Yeah?
Yes.
Okay. And during the assessment, I'm going to be touching you. Is that okay with you? Okay. And your mom's here in the room, and at some point, I'll probably ask her to leave. So is that okay? It'll be like 15 to 20 minutes. So, is there anything that you want to discuss today? Okay. And I'm just looking through your chart from the last time you were here. So, first, I'm going to start by looking at your head a little bit. Can you stick out your tongue straight? And then look at me with, look here. You just follow this light. Good. And again. Okay. I'm going to look in your ears with this other thing. Okay. Other side, please. Okay. And you open your mouth and show me your teeth and tongue. And your teeth. Okay, good. And I also want to perform a quick hearing screen. I'm just going to put these headphones in your ears, and then we'll see what the results say. And 5 minutes have passed, so we're done with that. And it looks like you have a good hearing screen. You passed. And I just want to touch your neck. Any tenderness or swelling there? Or that on this side? No? I'm going to look at your head and your scalp. I'm going to touch your head, okay? Is there any pain? Any pain in here?
No.
Okay. Now I'm going to do a little neurological exam. I want you to stand up with me, and you're going to mirror what I do, okay? I want you to put your hands straight up in front of you, like this. I want you to push up against my hands. Push up. I want you to grab my fingers with your hands, and I want you to squeeze. Squeeze with the left side. Squeeze with the right side. Okay. I'm going to have you sit down, and I'm going to check your reflexes on your arms and legs. So just relax this arm down. Okay. And on your knees, just relax. Look away from me. Reflexes are 2+, which is totally normal. Still look at your... Now I'm going to listen to your heart a little bit, if that's okay. Sounds like a normal, strong heartbeat. And have your sleep habits changed recently? Or did you ever wake up choking or gasping for air?
No.
No? Okay. I just want to see you take a few deep breaths. Sit up straight, a few deep breaths. Okay. And again. Okay. Good. And I'm just going to touch your tummy really quick. Just tell me if anything feels weird. Okay? Normal? Everything normal? Have you had any nausea or vomiting recently?
No.
No? And I want you to stand up, and I'm just gonna look at your hips. I want you to stand up in front of me. Good, and turn around. Okay, can you bend over and touch your toes? I'm gonna touch your hips. Okay, and then turn around. Okay, you're good, you can sit down. And I'm just gonna look at your arms and hands, and your skin. And I'm gonna look at your legs too really quick. Do you mind pulling up your sweatpants? Okay, good. Move your ankle around. And then the other side. We're gonna see your hand really quick. I'm just gonna check when I do this. I'm checking to see how quick the blood returns to your hand. Let me squeeze it. Capillary refill looks good. Okay, so this is the time where I'm gonna ask your mom to step out of the room. Is that okay with you? Would you like me to get another female office member to stay in here with you? Okay. So, okay, bye mom. So when it comes to your urination, do you have any burning when you pee? Is it painful?
No.
And I know you started your period 3 years ago, but has anything changed with that?
No.
Okay. And are you sexually active right now?
No.
Okay. I'm gonna get kind of personal, but have you been sexually assaulted at school,
No.
at home,
No.
and anywhere?
No.
Okay. Do you feel safe in your home?
Yes.
Do you feel like you're physically or emotionally abused or controlled?
No.
And what about a social network? Oh, here we go. Okay, so how do you feel at school? Do you have good friends, nice friends? Do you feel bullied at school?
No, I don't get bullied, and I feel okay with the friends that I have.
Okay. And what about a spiritual connection? Do you feel a spiritual connection with your Confucianism or anything else?
No, but I like when it rains.
Okay. You like nature?
I like nature, yes, and that's when I read.
And do you feel that you've been connected with nature recently?
No, but it sounds fun.
Okay. And so you're here today because why? What was the complaint? What was the chief complaint?
My mom got called from school because of my change of behavior.
Okay. Do you feel that that's true?
I don't know.
Are you worried about what your mom thinks about this?
Yes.
That makes you sad?
Yes.
Do you feel depressed or do you have thoughts of suicide?
No.
Okay. Well, I think the doctor's gonna come in and see you, but I think what we can do is try to make some goals for what you could do besides medication, what you could do. How would you feel about making a sleep journal? Sometimes kids are overwhelmed at school if they're not sleeping well, and you could just write down how much you sleep every night and maybe come back and see me in 2 months. Does that sound okay? And then you said you like nature a lot. How would you feel about having like a small nature garden, like a small garden that you tend to?
Yes.
Okay. And a third, let's see, and would you be comfortable in seeing a counselor at school, just going to check in maybe once a week or every 2 weeks?
Yes.
Okay, and then we can touch back on that in a couple months.
Okay.
Okay. So basically, head to toe, you look really good. I think what's going on is just 15-year-old girl stuff and maybe a little boredom at school. So maybe if you can mentally and spiritually get back on track with that, school would be more interesting like it was before, but not how it is now. Okay? I'm going to let your mom back in the room. Is there anything you don't want me to say in front of her? No? Okay. And then I just have to touch on this because you're a young female. When you do become sexually active, is there somebody in your life that you feel comfortable talking to about that? Maybe a school counselor? The same school counselor?
No.
Okay. Then it was nice meeting you,
Nice to meet you too.
and I will look forward to seeing you soon.
Okay.
Okay.
Like 8 minutes.